Hi, I'm Jane Mulcahy. Welcome to Law and Justice. This is a special series on the topic of relationships matter, and today I am joined by Charlie Jones. Hi, Charlie, how are you?
Hello, Jane. I'm good, thanks. Thanks for having me.
I am very excited to have you here, Charlie. So, before we get cracking, maybe you can just tell me a little bit about yourself and your background, please.
Yeah, so I'm in Bristol. So I'm sitting in the hospital that I work in. I work in an acute hospital, Southmead Hospital in Bristol. I'm a clinical psychologist by background, and I've been in this hospital 6 years. Been in the NHS 20 years.
Wow.
I'm a dad. Um, that's the main thing, I suppose. I've got two 9-year olds, two boys. Who are very lively, and I'm very tired all the time. Um, I'm originally from North Yorkshire, and that's still important to me. So Bristol's quite a long way from North Yorkshire, but I still feel very uh, attached to my roots, I think. And
Lovely.
I think all the stereotypes about Yorkshire of kind of plain speaking and just kind of simple things I appreciate. So yeah, I'm very interested in relationships and the relationship side of work. So it's really cool to be here talking with you.
Great. Thank you, Charlie. So, you mentioned that you're a clinical psychologist there, working in an acute setting. How important is any human being's sense of safety, attachment, and attunement, particularly in early childhood, for developing a positive and stable sense of self? Also, an ability to trust other people and to connect with them, and to learn and behave as expected in a kind of pro-social manner, Charlie. Big question.
I mean, I hear the question, yeah, as a psychologist, but also I suppose as a dad and seeing
Yeah.
my little ones kind of grow and yeah, big question. And I think I've never worked in a CAMS or children's family type service, but in the work I have done, so in medicine, I work with people with diabetes, people with asthma, gastro conditions, HIV, so basically medical conditions.
All right. Okay.
How people relate to their medical condition, like the relationship they have with their medical condition, the relationship they have with the medical team. There's a whole spectrum of relationship there, and you can when in our psychology team, when we meet with people who are struggling for various reasons, very often it comes up about early life experiences and how people learned about how to be in relationship, how to
Yeah.
be in relationship with themselves, how to be in relationship with their bodies, with people in authority.
Yeah.
So I think early experiences, whether it was more safe, whether it was more unsafe, those early experiences are hugely important.
Mhm.
Um, Thinking of the other contexts I've worked in, so I worked previously with older adults,
Okay.
and even speaking to people in their 70s and 80s, it's still very relevant to talk to people about what happened in their families of origin and kind of early years. And it's the patterns that we live through are heavily influenced by our early years, our early experiences. I mean, I think it's I think I just assume that to be the case.
Hmm.
And I think I've sometimes got to watch myself, because I think as a psychologist, I think I can be very keen to go to that place, and maybe the
Right.
person in front of me might be sitting there thinking, I thought I was here to talk about my diabetes. Why is he asking me about?
Yeah.
So I think, I'm very aware that that's there as a line of inquiry that I might want to make. But
Hmm.
I think you also need to, that might not be where the person in front of you is coming from or
Sure.
expecting.
Sure.
Uh,
I
but and
hadn't
also just to add
realized.
to that, Jane, I mean, that was talking about patients, I suppose, or
Hmm.
clients. I suppose it's also relevant to think about people who go to work in healthcare,
Sure.
who goes to become a nurse, become a doctor, become a psychologist, and what in our own upbringings has led us to that place. And so I think it's not just about patients, it's about
Hmm.
people.
Yeah, for sure. I hadn't realized actually that your current work was in the kind of conversations around medical conditions, which is also
Mm.
interesting because I've learned in recent times that often things like diabetes or asthma can relate to stressors from childhood, or the risk of developing them can be
Mm.
higher, or particularly asthmatic attacks can be also activated by current life stressors. So
Yeah.
it's just interesting, I suppose, the social world that we are born into, but then how we live our lives and what is around us, and also just, I guess, in relation to having a chronic illness or any sort of a health issue, who is there in our life to support us as well and make sense of our changed experience. That's also important, isn't it,
Mm.
Charlie?
Mm. 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 Yeah. Yeah, I mean, there's a lot there. I mean, the first part about almost the development of medical conditions, and I think, in the acute hospital I'm in, which is a really brilliant hospital and amazing colleagues, and we've got a fantastic building, and I don't think we're not there with that level of understanding. It's very much there's this medical condition presenting.
Hmm.
What's the medical intervention for that? I think, I don't know if within my career we might catch up with that kind of the cause,
Mm.
where this condition has come from.
Yeah.
I think hopefully we will, and
Yeah.
I think, so even when we talk about how can, as an acute hospital, how can we be more trauma informed?
Mm.
I think that's very much at the level of, someone coming for a lung function test or someone coming for a endoscopy appointment. How can that be, not re-traumatizing? How can
Right.
it, all the principles of trauma informed? I don't think we're not getting to the depth of, um, looking at why is it that people have developed these medical conditions
Mm.
in the first place, and is there a historical roots that might have led to people being more vulnerable to medical conditions. I think we're not there in terms
Yeah.
of that understanding.
Fair enough. Fair enough. And your other point about the fact that, like, we do all have an early childhood and an attachment history of some sort, that we don't just park, when we get to
Mhm.
30 or whatever and
Mhm.
become professionals. It's point well made that we're
Mhm.
relational beings from the start of life, and patterns, and even the reasons why people might want to become helpers, I guess. Um,
Yeah,
uh,
I'm really interested in that stuff. Yeah, why do we choose the path we do? Definitely. Yeah. Yeah.
yeah. And so you work in healthcare, as you say, in the NHS, which is, I imagine, a highly stressed environment with long hours. And certainly during COVID, there was an awful lot of, focus on the plight of healthcare workers amid, the massive overwhelm and stressors that the whole world was kind of dealing with. But you guys still had to go to work in hospitals. Many of the rest of us did not. And there are long waiting lists, various other system pressures, the deeply relational aspect of the work being, in a sense, diminished because there's
Mm.
so much else going on outside of your control.
Mm.
Would you agree, Charlie, that these pressures can diminish the relational side of the work?
Oh, definitely, definitely. I think it's I think there's always a will. There's if you talk in a team meeting, or if you talk about the importance of relationships, there'll be nods all around the room. We all value, continuity of care. Um, and then you get the yeah, but.
Yeah.
And so I think being relationship focused, attending to relationships is in tension with productivity, efficiency,
Mm.
getting through the waiting lists. I think these are not equally weighted in my experience. So I think we nod to relationships, but productivity is,
The master.
yeah. And I think it's, I don't know, I don't know how we move forward with that. I don't know how we elevate in real terms the importance of the relational side, because we all know it to be true. Like the evidence, for example, in general practice type settings, the evidence for continuity of care is so compelling. And people talk in terms of, if the effect of continuity of care was a tablet, it would be prescribed constantly, and
Yeah.
we know it makes a difference to see the same doctor, and yet we set things up in a way that makes that virtually impossible. And I think coming back to the stressors, I
Mm.
mean, COVID I think was different, and that brilliant ITV program was, I think showed an insight into what it was like in some places. I think there was a level of fear and kind of contamination and threat from COVID itself,
Mm.
which I think is really important to recognize. But my sense, speaking to colleagues around the hospital, is the bigger stressors are not clinical ones.
Right.
So you speak to emergency department people, and to me, as a psychologist, I'd be like, oh my God, how do you cope with, limbs hanging off and traffic accident, head injuries, and they do that.
That's
The
the job.
thing that's the job. The things that cause stress are that the IT doesn't work, or that the hospital over there is using a different system from what we're using, or that you can't park in the morning, or that
Yeah.
you're getting multiple demands from different departments around the hospital that are in conflict with each other. It's those things that cause the stress. It's off, and I think that's important. I think the perception can be that it's the kind of the grind of clinical work that causes stress. I don't think it is.
Mm.
Often it's these more systemic things that get in the way of being able to do a good job.
And you said there that you didn't know really what we could do to shift the dynamic a little bit more towards relationship-based practice given these realities. Is there anything that we can do though to rectify some of those system stressors, or are they just part of the complexity of this type of a massive system that's very expensive and has high stakes as well? So I guess that's some of it too. Like, is accountability sometimes a stressor that, the fear of getting things wrong and having to document everything to within an inch of his life, is that part of the burden on people too?
Yeah, I mean, the description you just made there makes me think of this idea of the machinery, the
Mm,
machinery of healthcare, and how it's like this big machine. And I think we think we can. This is the idea of humanizing the machinery. I'm not sure. I've thought about that as a framing for years, and I'm just not sure
hmm
it works. Like, because I think what it translates into is we can kind of put these widgets into the machine that might make it give a bit of breathing space, and I think we do that. Even that is quite a medical model, isn't it? Like putting a widget in a machine is like putting a tablet in a person. It's like we keep the main body the same, but we just add in something. And I think that's quite different from what's needed, which is much more of a structural enabling of spaciousness,
mm,
the possibility of pausing to talk to a colleague. I mean, I think, coming back to what I said in the last answer, I think there's definitely a will for relationship stuff, and we all talk about person-centered care. But I do think it's important to also recognize that much as we talk positively about person-centered care and relationships, I do also wonder if there's a bit of a dark kind of shadow side to that, which we don't talk about typically, which is to become closer to people who are sick,
mm,
dying, disintegrating in some way.
mm.
To do that is going closer to a distressing place.
Sure. Yeah.
And much as we say we want more person-centered care, we want more compassionate care. I think this has been written about for 70 years. Like Menzies Liff in the 1950s wrote very powerfully about the defenses that develop in healthcare settings to kind of defend
Yeah.
professionals against that getting closer to the lived reality of what
Yeah.
it's like to be sick. So much as our explicit narrative is we want more relationships, I wonder if there's a part of us that is kind of like, oh, can I
Mm.
really go there?
Yeah.
So I think that the thing that's always missing, in my view, why person-centered care is so difficult, is we don't have that infrastructure of supportive
Yes.
supervision, reflective practice, clinical supervision. In psychology, we have that.
hmm
So whether you're newly qualified or whether you've been a psychologist for 30 years, we all have clinical supervision regularly. It's not because you're struggling or because it's just it's a norm. We have supervision, and that I think that enables us to get really close to people
Hmm.
because we have that, and we don't cancel it. We don't cancel
Yeah.
it if we're too busy. It's
It
just
keeps
what
you
we do.
well, or
It keep
helps to, yeah.
totally enables us to do the work we do. And so I guess the question I come so because I experienced that myself, I know that it is possible,
Hmm.
but it requires almost like it just needs to be normalized and not a special thing that you add in.
Yeah.
It's just how and so you think, well, what if all nurses had that? What if all doctors had that? And it would be vastly expensive and have
Yeah.
have a cost to it,
Yeah.
but you could cost it. And then you could say, well, would the value of that be worth it for,
Yes.
for every nurse to stop once a month for an hour to kind of have I mean, it wouldn't be free.
No, it wouldn't be free, but again, if it would offset some of the, stress related burnout or other
Yeah.
illnesses that can form, and that mightn't be again attributed back to stressors within the system or anything else. Um, or also just contributed to kind of happier, healthier in general workers within the system,
Mm,
it would
mm,
strike me as worth considering. On an
mm,
interesting, I was just thinking as you were talking there that certainly the patient would love a bit more person-centered practice for sure in general,
yeah.
to
Yeah.
feel that the person took an interest in them and was trying to connect in a real way. And Stephen Porges, who I interviewed before, who is, the polyvagal
Mm,
theory sort of guru, he spoke about his own experience in hospital, around the age of 69 or thereabouts when he had prostate cancer,
right.
and how it was quite a demoralizing experience within healthcare, the lack of feeling that he kind of mattered as a person, the
Mm,
busyness of the healthcare staff, the fact that even with all his knowledge, they weren't listening to him. He didn't know in the same way that they knew the expertise, and it all had an impact on his experience afterwards.
mm,
And then his body crashed, even though he had the
yeah.
medical intervention that was
Mm,
necessary
mm,
for him. So we can't diminish the importance, but you're
mm,
so right that as human organisms, it makes perfect sense to build up defense mechanisms to the illness and
mm,
mortality of others, because how could you do it
mm,
otherwise
mm,
in a way
mm.
without support?
Yeah. Well, that is the answer. How could you do it otherwise? By creating this infrastructure of support. That is, and I think when you describe it like that, I mean, that's such a good example, isn't it? But if you calculated a number for what it would cost for every person working through healthcare to have an hour a month of whatever we call it,
Supervision, yeah.
supervision, reflective, for something
Yeah.
like that, the number would be vast. It would
Mhm.
be, I don't even want to guess. But then I suppose when you put that number against the cost of all this kind of rushing around and multiple consultants coming to see someone, having these rushed conversations and that where people aren't quite understanding each other, that cost is vaster.
Mm.
And I suppose that example could be there's hundreds of people in this hospital right now who receive rushed conversations where they haven't quite understood, they don't feel understood themselves. You know, in when you've got 5 minutes and you've got, a consultant arrives with a load of junior doctors and it's like bam, 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 bam.
Yeah.
The patient's left, what just happened there? And
Yeah.
and then they're left for the rest of the day. And that it's a really expensive, unsatisfactory process.
That's right. And also, the simple fact is, when we're stressed and overwhelmed, we can't process information well. So,
Mm,
even if we're
mm,
ordinarily comparatively smart with a good vocabulary, if we think we're really sick, and we might be really sick, and we're getting this news, we may not even remember it afterwards.
mm.
So, the
Yeah,
whole
yeah, yeah.
experience of that exchange as well, if it's all technical jargon
Yeah.
and in a
Yeah.
cold, sort of calculated, I must get through this as quickly as possible kind of way,
Yeah.
it just leaves the very vulnerable person
Yeah.
spinning. And
Yeah.
yeah, as you say, it's expensive and just um quite demoralizing at a time of just
Yeah.
terrible worry
Yeah.
and perhaps coming
Yeah.
to terms with an awful diagnosis for some people too, you
Yeah.
know.
I mean, what's really interesting about being a psychologist in a hospital is, we have, it's a very long road to becoming a clinical psychologist. There's a lot of years of, studying and experience and and I struggle with what it means to be a psychologist because I know that I've been very lucky to have all this training, but in the end, it comes down to very simple human things, it
Hmm.
seems. I know there's a lot more to it than that, but one of the things that I really appreciate hearing around the wards when I go to the wards, people will say things like, "Oh my God, thanks for just talking to me normally," and it just exposes there's this highly technical, very clever stuff going on, which obviously really matters,
Mm,
but there is quite an absence of it just has to be a few minutes, but just
yeah,
that human realness to just talk normally to someone
yes.
and for someone to feel like they matter.
Hmm.
And I don't think that's exclusive to being a psychologist. I think I have, colleagues from all kinds of professional backgrounds who do that too. But I do think the way things are really erodes the capability for that kind of time to be spent with someone.
Yeah. And I suppose if it's not a real core part of training as well, where it said like being intentionally as clear and compassionate and present as possible with all these
Mm,
systems pressures, you know,
mm,
and um, eh, translating some of the jargon, really
mm,
trying to be as
mm,
attuned as you can.
mm,
That is not, I don't think, part of
mm,
mainstream medical
mm,
practice to my knowledge, you know.
mm,
So
mm,
that might need to
mm,
be
mm,
worked in as something, not an add-on, because people do know it
mm.
helps if you've a nice bedside manner.
Yeah.
If it's not really prioritized, then you're not going to be so intentional about it,
Yeah.
maybe, or reflecting
Yeah.
as a practitioner, a busy consultant. Oh,
Yeah.
was I a bit gruff there and hiding behind the technical
Yeah.
jargon when what the
Yeah.
person really needed was a bit more of me in the moment or
Yeah.
something.
Yeah. 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 I mean, I was with a patient just one morning this week, and there was a knock on the door, and one of the consultants came in, and this person had a procedure the day before, and the consultant just knocked the door and said, "Yeah, I just came to see how you are today." And I just thought that was such a lovely thing that
Yeah.
took 30 seconds, but this consultant had remembered that this person had had a procedure, and it wasn't like a technical, I want to measure what you,
Yeah.
it was literally just a human gesture of
Lovely.
just wanted to see if you were all, and I just thought, oh, that's so lovely.
Yeah.
So it clearly is out there, but I think that's despite the prevailing
Hmm.
energy in the place rather than because of. And I just makes you wonder, what if we could set things up in a way that enabled that to be more standard? Because
Yeah.
I do think the vast majority of people coming into healthcare have this intrinsic motivation to care, to be generous spirited, to be healers, to
Hmm.
I really think that is there. And then that intrinsic motivation kind of comes up against this kind of grinding machine.
Yeah.
Um, and it's sad. It's sad to see. And I think we have to try and put things in place to kind of hold on to that inner kind of fire as much as we can.
Yeah. Thanks. Thank you, Charlie. So how I came across you was on the wonder that is Twitter. I refuse to call it by its new
Yeah.
name. Um, and I joined a thing called Spaces for Listening. I think I came across Brigid first, Brigid Russell, and then found you via Brigid. And so you and Brigid co-facilitate and devise this Spaces
Mm.
for Listening platform. Can you tell me how did you do it and why?
Oh, it's nice to. nice to think of Brigid. We've known each other 4 or 5 years, and she's made a very big difference to me.
Yeah.
Good to think of her. So Spaces for Listening was I think it was going back to 2020 at the start of the first lockdown. It's so normal, isn't it, just to talk to you on Zoom like this, but this was not normal a
No, I
few years
know.
ago. And I think that early stage of the pandemic, I think there was just this sense of, I think Twitter was coming into its own, wasn't it,
Yeah.
around that sense of the community that we can achieve virtually rather than in our neighborhoods kind of thing, and how valuable that is. And I suppose there was a sense of, when you reply to each other on Twitter, you can get so far and you can have a nice chat and you can get a sense of someone. But I
Hmm.
suppose we thought, what would it be like to actually meet people
Yeah.
properly? And what would be a good way to do that? And so, I'm a big fan of kind of some structure, on structure in kind of group type conversations. And we started with people who we would chat to quite regularly and just said, how would you fancy, getting together just to have a call? And it was very experimental. We only intended to do one and just to
Right. Wow.
see what it was like. And we came up with this structure, which is, it's a bit like, I mean, it's a very common thing, but it's like a kind of U shape. You kind of start off with a going to kind of to a depth, and then you stay at that depth, and then you need to kind of come up the other
Hmm.
side so you can come out of the call and carry on with your day, kind of thing. So we had 3 rounds on a Spaces for Listening, which are, how are you? We ask each other that all the time, don't we? How are you? And then the second round is any reflections or feelings, and then the final round is anything to take away and anything you've appreciated. And it's literally those questions, but the turn taking and the fact that nobody interrupts each other just creates this quite powerful, it's only like 55 minutes or something the call lasts for. But we did that one and we were really struck by just how meaningful it felt. And we wondered, is this just because of the context and because of the pandemic and everyone's just crying out for some kind of connection? But we did a second and a third, and with different people, it seemed to still be quite a powerful experience. And I think we've done like 380 something now.
Yeah.
And it's uh Brigid has, her husband died, Jim died just before we started, and I was coming out of a relationship,
Right.
uh, and that was, difficult with our sons, and then
Hmm.
so I think both of us were, and combined with the pandemic and everything else, I think so. I think we both have been processing our own loss and grief, and so it's not like we are doing an intervention to people.
Yes,
It's
I
much
get you.
more of a mutual kind of community space where we're all trying to make sense of what the hell's going on.
Yeah.
So it's been, and the fact it continues, I think, is because it still feels relevant and it still feels like it gives and it creates energy. It doesn't feel like work or, oh, I've got that thing at 9 o'clock tonight. It feels something to look forward to,
Yeah.
and a way to meet people.
Yeah, no, it's fascinating. I think I've joined two, and it was well after COVID. I might have been invited to join before I did, and for whatever reason I couldn't or wasn't up
Mm.
for it. I can't remember. But it is quite a special experience. It's very profound. It can be quite sad. You don't know what will come up.
Yeah.
You don't know what you might say that will then trigger some disclosure from someone
Yeah.
else. But the certain shared experiences, I think the need to be listened to really,
Mm. Mm.
the fact that we are all struggling in various ways, that humanizing factor that we're not entirely alone, I think,
Mm.
with
Mm.
a feeling of overwhelm or loss or, relational problems or worries or professional stuff, whatever it is. And then hearing some positive things and just, yeah, the being heard, and also allowing people to speak for 2 minutes uninterrupted. It can feel really long. Um, and then sometimes people don't speak, and there's a power in that silence too, and allowing it just to be. Um, but Charlie, why is listening so important?
Um, uh, I think there's something kind of respecting and honoring of each other, honoring of ourselves. There's something dignifying about listening, about I can be here, I can be in the world, I can take up space. I am worthy of your attention. I'm worthy of my own attention because I think listening is listening to ourselves as well. Um,
That's true. Saying it out loud,
mm,
whatever it is. Yeah.
mm, mm. So I think it's like a path to understanding, and I think that can be quite a cognitive thing around, a kind of reasoning and the kind of thinky stuff.
Mm,
But I think listening can also include something more empathic and a kind of sensing and feeling. And I think as you described that the 2 minute thing, I love it when whether it's myself or listening to someone else, you almost see someone, they start off with, oh, well, I was doing this today at work, and they say the kind of the surface stuff that's on their mind. And then there's a little pause, and then you hear what's underneath that.
mm,
And we all have that, don't we? We all have
yeah.
that kind of, there's the surface chatter, and then underneath that, there's loads of other stuff that often we
Always.
don't quite get to. And I think the more we listen, the more we can come to that deeper stuff. And as you say, it only takes a couple of minutes, and you can be into quite kind of really important, profound stuff about where is someone as a person
Mm,
in this stormy kind of world that we're in at the moment. And I think it's that feels honoring. I think it's when we get beyond the kids are doing my head in and I'm really busy at work. And then a few seconds later, you get to, so I'm wondering where my life is going. And
yeah.
I'm not quite sure. I'm at this big crossroads and I don't know what to do. And then that connects to other people. And they're like, oh my God, yeah, I feel like that sometimes. And you get this rich sharing of kind of common humanity.
Hmm.
And I think that comes through spaciousness and listening together. Like some space for things to unfold rather than just the kind of chat, 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 chat.
Yeah. And it's what I was surprised by as well is how like, well, I find you particularly quite poetic in how you describe things, including your own experience, or maybe, again, systems issues, or, the wider struggles that people can be facing work-wise. But other people too, there are certain common trends, and I think the whole lot of us really to varying degrees there's a lot of overwhelm in the world right now, politically, environmentally,
Mm,
the increasing complexity of family life, sometimes relational stuff,
mm,
working at a remove, which is great on the one hand, working from home, but COVID has changed the relational dynamics for many people. And then being back in the world, going to conferences, being a more public person has
mm,
changed for so many.
mm, mm,
I think that, there is what I've gotten from it as well is many people do have friends and family, but sometimes they cannot speak to them. They cannot share what needs to be shared for whatever reason.
mm,
So that it struck me that spaces of this kind, like for me, it was very profound listening to people
mm,
that I hadn't met before, and
mm,
how you can very quickly connect
mm,
and co-regulate as well, that just being listened can soothe the nervous system. It
mm,
can bring stuff
mm,
up, it can cause tears, but it can also, those tears have maybe been frozen for years
mm,
and needed to come out. Um,
mm,
do you think we can create more space for listening in places, including the workplace, Charlie? Are there benefits to it, do you
mm,
think?
mm, mm. Well. all of what you described. I mean, all the 12,000 people in this trust that I'm part of, I know people as their professional titles and what they do. All of these people, including myself, have this stuff going on. We all see what's on the news. We all, most people have some kind of family context, stresses going on, tensions and conflicts, and it's there all the time, whether or not we talk about it.
Yeah.
And it must be kind of influencing how we interact with each other, the decisions we make, the time we take, the time we give to each other. I mean, I've been in the NHS 20 years, and my experience is it's very, very difficult to reliably create this space.
Okay.
So, and that's not because there isn't a will. I think there is a will, but it is what we said earlier. It's just up against so many kind of quite fierce higher priorities that it almost like gets kind of chomped by these bigger things. And so the pattern I notice is you put stuff in the diary for a group peer support thing, or even just a lunch with
Yeah.
someone, or and then you cancel it an hour before because there's just too many other priorities are pressing, and that the temptation to free up an hour by not going to that thing, it feels in the moment more important to get through your emails or to write
Yeah.
that report or than it does to spend time
Being
calming.
together.
It,
Yeah.
it just in the moment it feels it's hard to prioritize. So I think I'm realistic. I don't know, 20 years from now, I'll be 66. I don't imagine we'll be in a healthcare system where there is regular space. I don't realistically see it. I think it's a constant um I don't want to use like a military type battle kind of
Yeah.
fighty word, but it does feel like that.
Okay.
Um my experience with Spaces for Listening is that it's very much a voluntary thing. Especially the one at 9 o'clock at night. You might think, God, why would I go and do something like that at 9 o'clock at night when
Yeah,
I'm
I've
supposed
thought that
to?
myself, but then I've been glad I did.
Yeah. But I think it's, we Bridget and I have seen that it works when people come to it off their own
Yeah.
volition. When it becomes a kind of corporately, we're going to roll this out within X organization, it becomes just another demand to, oh,
Right.
I've got to do that now. So I think there is something about making options available for people to come to.
Hmm.
I mean, don't get me wrong. I mean, Bridget does tons of organization behind the scenes to kind of create these spaces. But within an organizational context, I think it's a very holy grail type
Mm.
thing to come up with. Schwartz rounds, for an example, brilliant. I don't know if you've ever been to a Schwartz round, but they are in healthcare, they're in education, they are intentional spaces to pause and come together and connect with the more kind of human side.
Hmm.
Um, and they're great, and we have them here. And maybe 30 people come to it out of 12,000.
Right. Yeah.
So and for those 30 people, it's a fantastic experience.
Yeah.
And
Yeah. Yeah.
but it's like, what if you work on a ward where you can barely have 10 minutes to have a drink, and you know the
Yes.
the pressure is huge and overwhelming to be productive and busy. And so I think we have to be realistic. But coming back to what we said before, are we rushing around and being busy doing things that aren't quite as effective as we think they are?
Hmm.
And if we could, so I think you can probably make an effectiveness efficiency argument by saying if we could pause more,
Yeah.
our interactions would be so much more human and powerful. And so I think you can make it's not just being nice to do this stuff. I think it creates better interactions potentially. Oh my
But
God, I did not know how much I would go on and on and on.
yeah, no, no, it's wonderful. But you make the good point that mandating things is very different to voluntarily opting in.
Yeah.
And even therapy, it's kind of unethical to be forcing therapy on people, if even if they need it and would benefit from it, if they don't want it or are not ready for it. So the idea of, there have been times I've not wanted to talk about things, not been able to talk about things. I might have known I'd probably benefit, but I wasn't able to go there. So I
Mm.
think there's maybe that too for people in systems, that the only way they can get through the stress and overwhelm is to barrel through it and
Mm.
to not think about it and
Mm.
to just keep in that kind of fight mode of get to the end. So the avoidance, the denial of the feeling that might be way down there at the very bottom of the iceberg. It's to not go to the supervision if it's offered, to go into the emails or to drink their fizzy drink or whatever else. There are good reasons for that too,
Yeah.
actually.
Yeah.
So that because if someone has had something in them for 10 years that hasn't been expressed, and eventually at a spaces for listening it comes out,
Mm.
there've probably been many opportunities along the way to talk to someone, but for
Mm.
whatever reason, we haven't been amenable to it. Isn't that also part of human experience at times, that the timing has to be right?
Yeah, oh, totally, totally. I'm so with you. I think the timing, if you can get the timing right, then sometimes I think the intervention doesn't have to be that lengthy
Yeah.
if it can combine with timing. And what we say in our psychology service here is I mean it's quite a flexible service, but because we're working with long-term health conditions, these are not things that are going to go away for people. So we have a kind of 12 session guide,
Hmm.
but when we come to the end of that, if you like, we say to people, take our details and you get in touch with us if you need to.
Hmm.
You don't have to go through a GP or anything, just come directly to us and recognizing that with a long-term health condition, there will be flare-ups, there will be difficult times, and we want to be responsive to get the timing, as it's needed. And I'm really glad that we're able to offer that because it feels being able to be responsive kind of honors that sense of timing, I
Hmm.
think. So rather than it being service driven, you sit on a waiting list for 2 years and then finally the letter arrives and it's like, well, I don't want it now. I think the timing is so important. Yeah.
Yeah. What has been one of the main learnings that you've had from co-facilitating spaces for listening, Charlie? And has it changed your own day-to-day practice in any
Mhm.
way?
I think the main learning is just the appetite to be listened to and to have a bit of space. I mean, it's very moving hearing, especially people who come for the first time, seeing people kind of almost physically, shoulders dropping and just the
Yeah.
impact. And I think it's really, we can get very heart sinky, I think, about things like culture change, like, oh, culture change, or where do you start? But like, I think the fact that you can see a sense of safety within 15 minutes on
Mm.
this video call with, strangers, I really think gives a sense of what's possible
Hmm.
when we're working in systems where everything feels so impossible. So I think there's a lot of hopeful energy about spaces for listening, but I think I've become much more. I really like turn taking
Hmm.
in meetings. I've become really intolerant of shit meetings. Like it does my head in, kind of sitting through meetings which just go nowhere,
Yeah.
and um,
Where
so I've
one
become
or
really,
two people dominate, maybe.
yeah, yeah, and I just think turn taking is it's a very small. I think we can resist structure like that. It can feel contrived and it can feel artificial, but I think it can be very freeing.
Hmm.
And something I've noticed, just as an aside, with like Teams or Zoom calls, work calls, I really love that thing where you can put your hand up.
Yeah.
I love that. And that reminds me of turn taking because I find it really stressful and I use up a lot of energy in meetings where I'm like, how do I get in to say my point? And it means you're not listening to the people, you're just listening for the gap so you
Yeah.
can get in. Whereas this thing on Teams and Zoom where you can put your hand up and your turn's coming, I just find that really helpful. And I think spaces for listening is a bit like that. You know where your turn's coming, so you don't have to use energy figuring out how to get in there, kind of thing.
Yeah.
Um,
And I suppose the turn taking as well, certainly in spaces for listening, you have your 2 minutes in these three rounds. You don't have to go right to the end either, if
mm,
you have
mm,
nothing more to say. Um,
mm,
but in a meeting format at work, I guess that turn taking does allow everyone to be heard in a way that
mm.
other times it might not. It democratizes the
Yeah,
process a bit and
yeah,
equalizes things, and everyone is then equally important in terms
yeah,
of the allotted time, which is again unusual
yeah.
probably.
I think that's really powerful. Yeah, the
Yeah.
equalizing effect, absolutely. And I think related to that, I think there's implications for, I mean, Brigid's a coach and a consultant, and but we're very overlapping, I think, in how we think and do things with some differences as well. But I think for psychology, I think there are implications around like part of spaces for listening is you facilitate and participate at the same
Mhm.
time. So I think some psychology kind of spaces can be the psychologist who says nothing
Yeah,
and
yeah,
sits stroking his beard or her beard
yeah.
and um
Wiping the glasses, yeah.
and I think there is a kind of there can be quite a lot of power dynamics going on there, and I think the fact that you facilitate and participate is really important for equalizing
Mm.
and being a person as
Yeah,
well. And I know that's been impactful for Bridget as well in terms of how she works and being in the space
yeah,
rather than some kind of neutral facilitator who is very outside of the process. So I think
yeah.
that's really important.
Yeah, the being willing to be vulnerable at times, I think, is really, really powerful too. As a manager, it's
Mm,
difficult, but I do think it allows sharing to occur that otherwise will not happen if
mm,
it's the other people, saying,
yeah,
"Oh, I have these difficulties," and then there's that distance. Whereas if you model the behavior, and I mean, it doesn't have to be
mm,
the biggest,
mm,
deepest, darkest secrets, but just
mm,
something a little bit human uh, goes a long way to making those heart-to-heart connections a
yeah,
little bit more. Yeah.
definitely, definitely, yeah.
Just to return to healthcare briefly before we finish up, from attending the couple of spaces for listening, there were quite a lot of people from healthcare in the UK on the calls,
Mm,
and I got very much a sense of people feeling a bit distanced from their own personal values because of the system pressures. Now, it's not the only time I felt this. I felt this too when listening to youth justice workers who come in wanting to help children who are, stressed, traumatized, poor, lacking in social opportunities. And then the system demands things of them and accountability, and they're working through these processes that can feel a bit at odds with why they got into the work at all. Do you
mm,
think in these complex systems, there's anything that can be done to prevent this distance from occurring,
mm,
or to remedy the effects of feeling disconnected from the values, or is it just again part of the
mm.
complexity of the giant systems?
I love the question, and I think where it takes me to is, and I think again, there's a kind of implication for psychologists in systems here around I think we can be so quick to go to a kind of psychological interventions place, and how can we set up groups and offer psychological therapies and what your question makes me think of is moral injury.
Right.
So when we're not able to do what's congruent with our inner wish. And
Hmm.
I think the most moral, so if that's moral injury, I think the most morally nourishing thing we can do is to be able to do a good job,
Hmm.
whether it's with a family, a patient, if you can feel like I did a good job there, I made a difference to that person. That is a kind of morally nourishing, morally congruent experience. I think that is the most worthwhile thing. And that I think is that is the intervention. Of course, there's a place for psychological therapies and counselling, and of course there is. But I think what when you speak to doctors and nurses, what people want is to be able to do a good job or a decent job. Um, and I think any ways that organizations, managers, leaders can support people to do a good job is such a restorative experience to have. Um, so I think that would be the priority is um, trying to notice where the blockages are to that and how what can enable, either a shift or even just one experience with a patient where you're able to do well for someone. I think that just is such a boost. Um, there is definitely something about, I think this came up earlier, but just this sense of intrinsic motivation is what people come in with, but I think the system, if you like, very much demands is about external
Hmm.
motivations. So compliance and targets and getting your notes done, doing your Statman training. It's
Yeah.
all so we have this tension between what you want to do intrinsically, but you've got to meet all these extrinsic targets, and I think there is something quite stripping about
Mm.
that process, and but the way to kind of keep connected to the intrinsic stuff is by doing a good clinical job.
Hmm.
I think, I mean, it is as simple and as complex as that because it's hard to do a good job. But yeah,
Yeah. And bearing in mind that in any of these systems as well where stakes are high, and again, in the healthcare setting, people can have terrible catastrophic injuries, or bad things can happen clinically. Mistakes can also be made. But I suppose as well, like part of the accountability stuff, and fears around scandals or anything. I don't know how much they weigh on workers. But certainly, as a researcher, I value accountability and record keeping, because it's a source of data for learning. But definitely no one enjoys admin. I don't, or very few people get excited about the admin side of any tasks. And I suppose it is about balance where people can do the bits of the job that they most enjoy and got in it for
yeah,
without being just swamped by all the other stuff
yeah,
that sucks the joy out of it. Yeah.
yeah, yeah. Yeah, I think, I mean, I think trust is in there, isn't it? Around, I
Yes.
think if, I think it's very easy to get into kind of management bashing. I like probably all the managers I know here are lovely people, hardworking, caring people, conscientious, and there are some things where it's obvious what an ask is for. So, you're asked to do some kind of date for some data, or it's obvious why that's necessary, and you don't mind doing that. And whereas I think it's when there are admin tasks where you feel like, what is this? Why am I spending time doing this when it's completely a meaningless exercise for compliance with blah and blah? But somewhere it will be meaningful to someone. But I just think that the lack of there isn't the time and space to
Hmm.
explain everything.
Yeah.
So then you have to kind of trust people. Well, if I'm being asked to do this, it must.
Hmm.
But I just think things are so big that it's hard to always understand why you're being asked to do something. And I think as soon as a task feels like labor
Yeah.
and it's getting in the way of spending time with that person you want to spend time, then that's a real tension, I think.
Mm. Great point. I've just one final question, and I kind of ask this type of question to everybody because I'm
Mm.
very interested in the policy making side of life. What can politicians and policymakers do to promote safe, healthy relationships that prize listening, Charlie, in childhood and indeed across our life course?
Mm. Wow. I mean, I really love that idea of it takes a village. So something about community and relationships around a person, and um, and I just feel so many people don't have that village, and I don't know how we define that in 2024. What does that mean to each of us to have a village? But if I think of what do my boys need, what do young people need, I think there's something about adults who are present
Hmm.
and not full of anxiety about cost of living and about rent. And it just feels like there's an awful lot of anxiety around just because of how austerity, the impact of austerity. And so I think understanding, starting from the point of young people need adults who are present and have capacity to engage
Mm.
is a starting point. And then we might think, well, what would enable that to be the case? I think it's a really big question.
It's a massive question. I was
um,
thinking, yeah, my own children would benefit from a bit more presence of my own. But you're so right. When you're in turmoil over financial stressors or whatever else, workplace just grinding stress and overwhelm, it's quite hard then to come home and be super attuned and really zoning into what children need or what our partners need or what anyone else needs. We're very much then, we become more isolated actually by virtue of the overwhelm that we're each
yeah,
feeling, and then disinclined to share it because our cups are already too full, that we have no little bit more to
yeah.
give, and that is an issue. So
I mean, I would say, I think hearing the word isolation, it feels, I'm got such lovely colleagues here, and I'm massively privileged in a lot of ways, but our sons that are not in mainstream education, and I think because of that, like I don't hear about, all the kind of pressures and stuff that happens in schools. I don't, I think, isn't it Red Nose Day today? I saw some
you're
kids
right.
were, so our boys don't have, when it was World Book Day,
Uh-huh.
where they are at, they're not in a school, they're in this kind of alternative learning place. There is an isolation to that world that
Sure.
we're in, like we're not in a mainstream world. And I think so, I'm thoughtful about, people generally, but where is my village and our village as a
Yes.
family? I think it's really important to have some sense of that. And if you notice that something like that's missing, then what do you do? And I very much, I love reading a book with one of my sons or both of them, and just that very quiet time. But I am really aware of, the emails are pinging on my phone, or there is this real competition for attention, I
Yeah.
think. Um, and I think pockets of time when we can be really attuned and present are very valuable.
Precious.
Um,
Yeah. But we can't be too hard on ourselves either, Charlie, simply because of the stresses of the world. And as you say, the social media kind of demands, it's very easy as well to get hooked on that,
yeah.
because sometimes it's easier to have these more removed, distanced relationships than the ones in the here and now. And it's not necessarily either or, because certainly, I've learned loads from people online, loads and loads of very valuable things in a kind of academic sense, but also a personal one. So I hear you. We do all need the village at all points in our lives and developments. And thank you to you and Brigid for the spaces for listening, because it is a kind of little village and an oasis
Yeah.
that people can opt into
Yeah.
for 55 minutes. So
Yeah.
look,
Yeah.
thank you so much for your time and insights. This has been Relationship Matters with me, Jane Mulcahy, and the lovely, wonderful Charlie Jones. Thank you, Charlie.
Right. We're good.
We're good.